Common scenarios or mistakes found when entering in orders in CanTime. So these are the things that you do not want to do. Number 1, multiple medication changes. If there were several changes by one MD on the same day, we would expect all orders to be done on one order. You may repeat the process of discontinuing meds and adding new meds as many times as necessary within one order. So in this particular example, we have 1, 2, 3, 4, 5, 6 orders for 7/27/16, all from the same clinician for the same doctor. We have 1, 2, 3, 4, 6/29/16 orders, again, all for the same clinician, all for the same doctor. So I don't want to send 10 orders out to the doctor. I only want to send 2. Okay, so all of these orders should have been combined and only 2 orders should have been created to begin with. Remember, if you go to the doctor and they have 100 new meds, you only want to do them on one order. You can add new medication 100 times, but only create one order. The second scenario is physician order without a change order. Now there are 2 types of orders in CanTime, physician order and change order. The main order you will be dealing with is the change order. Physician orders are for things like ordering new DMEs, not the use of the equipment, but ordering new DMEs, follow up in 2 weeks, hold speech therapy, or even holding a medication for a small duration of time. That would be on a physician order. Okay, otherwise, if you want to make a change to your plan of care, a change to your MARS, a change to your care plan, it needs to be on a change order. Okay, you'll notice this particular order is written out very nicely. It tells me I'm DCing meds and I'm starting a new one. But the nurse called saying, I do not see these meds on my MARS. Well, you won't see them on the MARS because it's not a change order. You didn't make any changes to your care plan or your medications on your MARS. You only did a physician order. And I knew that without opening the order, because it says P. P stands for physician order. That means no change took place on my MARS. So be sure to select change order when you want to make a change. Scenario 3, if the med is ordered today but picked up tomorrow. Now I know this happens a lot and it is okay as long as we explain the discrepancy within the order itself. So the best way is to actually add the start date on my order description. I can send it out for signature, the doctor will sign it, and that's his okay for me to actually not start it the day I received the order, but the next day, just as noted here. My order was actually received on 5/19, but I didn't pick up the med until the next day. Well, that's when I started it. It is important to have the correct start date and DC date, especially for antibiotics that have a specific duration. So when I'm adding this new medication while creating my new change order, I will put the correct start date, the day I received the med, and also enter in the DC date, which reflects 5 days later, as per the order. Okay, so once I do this, when I hit autofill, it will not tell me the start date. Okay, so this itself looks like a discrepancy because I have an order date of 5/19 that says times 5 days, but then I didn't DC it till 5/24. It looks like a med error because I could question, did you give it an extra day? Even though you didn't. So the best way is just to add the start date. Otherwise, I would ask you to remove this information regarding the discontinued date because I did receive an order on 5/19 for azithromycin times 5 days. So this alone, new medication information, would be sufficient. However, I would ask you to submit a case conference indicating that you noted the doctor and your case manager why the medication was started late. So while this is an option, again, the easiest way is to just add the start date within the order description itself. Number 4, a hold order. Hold orders may be entered on a physician order alone if med is to be held for a small duration, not a change order, because there's no need for you to discontinue the med right now, only to have to add it again in a couple of days. Okay, so hold orders can be on the physician order. Keep in mind that you do not add add that comment, hold until medication is complete, here within the edit medication pop-up box, because this medication pulls to all of your Mars comments, okay? And we don't want that. This is incorrect. It is only for a small duration of time that the medication is on hold, so you would write the comment within your eMARS. Number 5, a physician order with a change order. Now, both these orders were received on 2/19/16 for the same patient from the same doctor. So I told you there was 2 different types of orders, physician order and change order. Well, this particular clinician made sure to separate and put what belonged on the physician order and what belonged on the change order on the change order. However, remember, I only want to send 1 order to the doctor, not 2. This was the same doctor, same day. It should have been on 1 order. Keep in mind, the change order always wins. If I want to see this medication on my Mars, I need to put a change order in, okay? So what I would do is I'd create the change order, add my new medication, and then simply manually enter in the rest of the information into the order description that would have been on the physician order, okay? Change order wins. Number 6, the comments in the order description. This particular comment says, Mom refused to pick up med today because she needs to get ready for a quinceañera. I informed oncoming nurse Jessica Flores and she became upset with Mom for not taking care of her child. Now, while this did not actually happen, I had a similar situation. That's why I need to bring it up, because this goes out to the doctor. The doctor will see this comment before he signs it. So it is very important that you limit comments to only triage information, signs and symptoms regarding this particular medication. Anything that you would normally write on a clinical update summary of a paper physician order is what you would write here as a comment, okay? No complaining about case managers or other nurses or caregivers, okay? We can keep that to ourselves. Number 7, if a med is ordered at 1 dose times 1 day and then a different dose times 4 days, when adding this new medication, they should not be added all together. You'll notice here it says dosage 1 tab times 1 day, half tabs times 10 days, all with the same start date. Well, that's incorrect, because this should be listed as 2 different meds on the same order, but 2 different meds, because they have 2 different start dates, 2 different end dates, and 2 different doses. And all of that needs to be reflected properly on your Mars, okay? So once you separate the 2 and hit autofill, remember that you'll have to manually enter in the start dates to differentiate the 2. So you'll notice here I've autofilled, and then I have the information daily for day 1 at 1 tab. And then my next order, which started on 5/5, says daily for 10 days at half a tab, okay? It's very clear as to when you should be starting the next dose. The next scenario, same med, different doses during the day. This particular medication has a dosage of 1 ml QAM and 2 ml QHS. Now that does not mean BID. BID means the same everything twice a day. This particular medication should have been entered in as 2 meds, again on the same order, but 2 different meds because they have 2 different frequencies and 2 different doses. Now in this case, when I hit autofill, I will not have to enter in an order date or a start date because they both match the 5/4 order date. This one is the hardest type of MD order. If you can do this, I think you can do anything. If you come across an order like this for a wean down schedule, feel free to call the office for assistance, but I do want you to try. Do your best to go ahead and input it and then call, and we're happy to review the order for you. This particular order, start tapering phenobarbital 20 milligrams per 5 ml of 6 ml per GT BID for 1 week, then start tapering 1 ml BID per week afterwards. This particular clinician put the entire wean down schedule in one order. Now, while she may be the only nurse in the home and understands this order completely, if I myself were to go into this home, it leaves big room for error. I may give the wrong amount if I do not know what the tapering schedule looks like. Okay? I know this looks a little overwhelming, but this is the proper way to do it by entering in multiple new meds, again, all on one order, but add new med, because they are different doses, different start dates, and different end dates. The nice thing about this is if I entered this in correctly as a new nurse going into the home to cover, if I went in on 6/1/16, my MARS would only show me 4 mLs. I would not have all of this medication listed there. Less room for med errors. You will only have what you need when you need it if it was entered correctly in the system. Okay, with the correct start dates and the correct DC dates. Again, once you autofill, you do have to manually enter in these start and DC dates. So make sure they are correct.